So for the head to toe assessment, I don't need a physician's order, although I would want to know if my patient was on oxygen, so that I could check what the flow and the rate was. I would also want to know if they're on any IV antibiotics currently going on that I need to be aware about, so that I could just check that as I go in. I would want to gather my supplies. I would have my watch, my gloves, my stethoscope, alcohol swabs. I would have my pen light, my tongue depressor, and if they had wounds or incisions, a ruler. My patient does not have any. And then also a bath blanket. And then I would go into my patient's room. I would wash my hands and provide privacy. Hi, Mrs. White. My name is Cam Chafee, college nursing student. How are you?
Good.
Good. Is it okay if I see your ID band? And can you tell me your name and date of birth?
Haley White, July 5th, 2001.
Perfect. And do you have any allergies?
No.
Perfect. So I am going to be doing a complete and thorough head-to-toe assessment. I'll be checking your breathing, checking your skin. At times you'll feel my hands touch you. At any time you have any questions, please let me know. At the same time I'm doing that, I would also want to check to see if she's alert-oriented ×4. I could ask her what brought her into the hospital, getting her talking about it, so then I would be able to see if she was alert-oriented ×4. I would want to check her general appearance. She seems to be well-groomed, hair is well-kept and clean, face is clear and clean, her arms look good or intact, her color is normal. I don't see any malnourishment. She looks well-nourished, doesn't appear to be dehydrated. I would be nudging the bed, making sure the bed is locked, making sure the side rail's up. If she was on oxygen, I would make sure the nasal cannula was in correctly. I'd be checking the flow rate to make sure that's correct. Her IV, I would be checking the IV site. I would want to make sure that it's intact, there's no swelling, infiltration, that it's not cool to the touch, checking for any phlebitis going on, making sure the flow rate with her IV was set fine, making sure there's nothing on the floor, no cords or any loose items that the patient could potentially fall on if they got up to go to the bathroom. Yeah. So then I would want to make sure I'm covering them with a bath blanket. Make sure that they stay warm. And then before we begin, do you have any pain?
No.
No? And do you need to use the restroom?
No.
And when was the last time you had a bowel movement?
An hour ago.
And was that normal?
Yes.
Okay, and are you pretty normal? You go every day?
Mm-hmm.
Okay, perfect. And when was the last time you urinated?
An hour ago.
An hour ago too? Okay. And any pain or discomfort, notice any odor, any of that when you went to the bathroom? No? Okay, perfect. And do you wear glasses?
No.
And what about contacts?
No.
Any hearing aids?
No.
And what about any dentures?
Mm-mm.
Perfect. Okay, so we're going to go ahead and get started with the head to toe. I'm going to start at your top first. I would make sure that the bed is up to my height level, and I would raise the bed. If the patient was down, I could at this point check for JVD, the jugular vein distension, as I'm raising the bed up to a 45 degree. I'll raise her up. Okay. And then I would just start my assessment at her head. So I would just gently palpate. Have you had any injuries or falls in the last 2 weeks?
No.
No. Her head is normal, round, no masses. Hair is clean and well kept. Her eyes are even, nose is symmetrical to her mouth and down to her midline to her trachea. Everything appears to be symmetrical. No drooping. Her speech is good. There's no slurring or any of that. Next, I would put on my gloves. I would want to check her eyes. For her eyes, I'm going to check both of them at the same time. Just slightly pulling down, you're going to feel my hands. I'm checking her conjunctiva, which are pink and moist, normal, no drainage, no redness, no crusting going on. Her scleras are white, and again, her eyes are even. Excuse me. I'm going to remove my gloves. Excuse me. And I would wash my hands. Next, I want to check for Perla. So if you can go ahead and look straight that way for me. I'm going to do the right side first. I'm going to come in swooping. 1, 2. And her right side is equal, round, reactive to light. And her left. 1, 2. Again, her left is equal, round, reactive to light. Now I'm just going to check for accommodation. Excuse me. You can go ahead and watch this as I bring it in. Perfect, and her eyes accommodate. Next, I'm going to check her nose. Have you had any injuries, broke your nose, or any difficulty breathing through your nose at all?
No.
No? Okay. Just checking to see if there's any blockage, any deviated septum, any skin breakdown or wounds or anything that's noticeable, and it looks good. Next, I want to check the mouth, so I'm going to get my tongue depressor. I would push down on the tongue, checking the oral pharynx. It's pink and moist. Checking the inner cheeks, looking at the oral mucosa and the membranes. Oral membranes look good. Tongue is pink and moist. I don't see any dental caries. Roof of the mouth looks good. Her lips are pink and they're not dry or crusty. They're normal color. Next, I want to check her ears. If she was on oxygen, I would remove the oxygen from her ear so that I could check the tips of her ears here, making sure that there's no skin breakdown. Checking the back behind her ears, making sure there's no breakdown, no rash, no bleeding. Checking the inside, making sure there's no drainage, there's no excess cerumen. Everything looks good there. Normally I'd walk to the other side, but my patient is so good she can turn her head for me. Again, I would check if she was on oxygen, I would remove it. Checking the tip here. Again, checking inside, making sure there's no drainage. Checking behind the ear, making sure there's no skin breakdown, no rashes, redness, bleeding, or any excess cerumen. Everything looks good there. Next, I would want to palpate her neck, checking for any tenderness or swelling or masses. Let me know if you have any tenderness. Everything's good? No pain? Everything appears to be normal, no masses, no tenderness. Next, I want to just check her pulses, her carotid pulses. So on her pulses, for her carotids, we only do them one at a time. So I'm going to check her left one. Good. And now I'm going to check her right. And good. Next, I want to listen to her carotids. Get my stethoscope, and I'm going to clean it with an alcohol swab. And I'm going to listen. And I want to listen for no sound. I shouldn't hear any sound. If I do hear any sounds, it could potentially be plaque, and I would want to notify the physician immediately. And I would do the same on the right side. And perfect. No noise. Normal on bilateral carotid. The next thing, I want to do is I'm going to check her skin turgor. I'm just going to gently check it right here on her chest by pulling and tenting her skin. And it rebounds, showing that she is well hydrated. Next thing I want to do is I want to listen to her heart sound. So I've been playing with my stethoscope, so I'm going to clean it. This time I want to use the bell side. I'm going to start on her right side, and I am going to find the second intercostal space on the right side, which is the aortic, and it will be right side sternal border, second intercostal space, so right here. That is the aortic, and I want to listen for the lub-dub, lub-dub. Then I want to go to the left side, second intercostal space, left side sternal border, right here. That is the pulmonic, and I want to listen there for the lub-dub, lub-dub. The next one I want to go to is the third intercostal space, which is Erb's point, which is left side sternal border right here. And I want to listen for the lub-dub, lub-dub. The next one, here's her sternum, is the fourth intercostal space, right here, which is the tricuspid, right there. And I want to listen there for the lub-dub, lub-dub, With females, we can either ask them to lift their breast to get to the 5th intercostal, or we can do it by lifting them up. She will go ahead and lift hers for me. So here's her sternum, and then the 5th intercostal space to the mid-clavicular. We want to listen there, and that is the mitral. And we want to listen for the leb-deb, leb-deb. Also right here is where we would want to listen for AFib. If we were going to give medications, we would listen for 1 full minute. Heart sounds are normal, leb-deb, and all. Next, we would want to listen to her lung sounds. As I'm doing that, I would be assessing for her breathing pattern, which is normal. There's no accessory muscle being used, no shallow breathing. So on the anterior side, we're going to listen at 10 places. We're going to start up by the clavicle. And we would ask them to take deep breath for us, but I'm not going to have you. A 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And again, all of this would be under the gown, not on top of the clothes, so that our stethoscope would be touching the skin. Next, since my patient is very flexible and can sit up, she's going to go ahead and sit up for me, so I can go ahead and assess the back and just do the back lung sounds at the same time. As I'm doing this, I would want to check the neck, making sure that there's no skin breakdown, it looks good, no masses. Just checking the spine, making sure it's straight, no scoliosis going on, no bulging or any of that, making sure there's no skin breakdown, no swelling, no rashes going on, no incisions. And then I would want to listen. I'm going to listen to 8 places on the back. I'm going to start here. 1. Again, we would have them take deep breaths, and that would be 2. We would come in, 3, 4, 5, 6, 7, 8. Okay, go ahead and lay back down for me. Okay. You okay? Okay. The next thing I'm going to do is just check her arms. Again, I'm going to check the IV side again, just in case if I hadn't did it earlier, just to again make sure there's no infiltration, no phlebitis, it's not cold to the touch, it's still intact, no bleeding or any of that. Checking for skin breakdown. I'd be checking their nails, making sure there's no clubbing going on, checking cap refill. Since she does have nail polish on, you could check the nail beds, but if they have polish on, you can check under the tips of their fingers. Rebounds under 2 seconds, showing good capillary refill. They're warm to the touch, not cold and clammy. Want to check range of motion and strength and sensory. So are you able to lift your arm for me? Perfect. Just checking range of motion, making sure there's no skin breakdown, checking the axilla and the side of them, making sure there's no breakdown or wounds, bruising, rashes going on. Good range of motion. I'm going to check her strength. Can you go ahead and push down on my hand? Perfect. And what about up? Perfect. We're going to do the same on this side. So her nails still, again, no clubbing or intact. They're clean. Grooming is well groomed. Cap refill, again, is good, under 2 seconds. And this side is the same temperature. They're both even and warm to the touch. Go ahead and check range of motion. Perfect. No skin breakdown. Axilla is good. No rashes. I don't see any there. I'm going to go ahead and check strength. So I'm going to have her push down. Perfect. And then up. Perfect. Then I'm going to check grip strength. If you can grab both fingers and squeeze. I want to make sure grip strength and motor strength is equal bilaterally, which they are. Then I'm going to go ahead and check her pulses. So here I'm going to check her radial pulses. Making sure that they're even bilaterally, which they are. Then I want to check her brachials. Even bilaterally. Good. Next, what I want to do is check her sensory on her upper extremities. So if you could close your eyes for me, and I am going to lightly touch you. Wherever I touch you, please let me know where that's at, okay?
Left pinky. Right lower part of the arm. Left opposite elbow thing. Right middle finger.
Perfect. See you later. So now I'm going to go ahead and lay her down so that I could check her abdomen, and then I'll work my way down. At this time, I could check for JVD if I wasn't able to do it earlier as I lay her flat. And I could just check for the JVD, the jugular vein distension, at the same time. Okay. So now I'm going to go ahead and just check her abdomen. First thing I want to do is just assess it. I want to look, make sure it's not distended, there's no bulges, I don't see any masses, it's not concave, so she's not malnourished, she looks very nourished. It looks symmetrical, doesn't look uneven. The next thing I want to do is listen. So again, I'm going to clean my stethoscope with an alcohol swab, and I'm going to take the abdomen and divide it into 4 by the umbilicus, and I'm going to start in one quadrant, and I'm going to listen for 1 minute. 1 minute, I want to hear 5 to 35 bowel sounds. If I hear under 5, then I need to listen. If I hear under 5 bowel sounds, I need to listen for a solid 5 minutes, and you would want to time it. But each one right now, I'm going to listen for 1 minute. And then the third one, 1 minute. And the fourth one, 1 minute. Bowel sounds are normal in all 4 quadrants. The next thing that I want to do is palpate her abdomen. And I'm going to lightly do that. As I'm doing that, I also want to watch my patient to make sure that there's no grimacing or guarding going on as I'm doing it. You're going to feel my hands. Again, I just want to continue to watch my patient. Abdomen is soft. There's no distension. It's not hard. Don't feel any masses, and it's even. The next thing I want to do is palpate the bladder. Again, I want to watch my patient, make sure there's no grimacing or guarding as I'm palpating the bladder. And I would be telling them as I was touching them as well. The next thing I would want to do is just palpate her femoral pulses. So those I would want to do at the same time again to check the even pulses strength on bilateral sides, which are good. Next, I would go down to the legs. Just going to lift up your blanket. Making sure that they stay covered. Again, I'd be checking the legs. I would be wanting to look for any edema. If they had edema, I would want to be checking for pitting. I would want to see if there's any rashes, skin breakdown, any wounds. Is their skin pink and normal looking for their ethnicity? I want to check range of motion and sensory and muscle strength. So since she is able to move, I can check her her range of motion. Can you lift your right leg? Perfect. At this time, I would be able to check to see if there were any wounds. I would want to check the bottom of the feet always to make sure there's no wounds there, and checking the bottom of the feet and the heels. No wounds, no breakdowns, no rashes. At this time, I could check for strength. Can you go ahead and push down for me? Perfect. And what about up? Perfect. And then let's do this leg. Again, checking the heel for any breakdown, the bottom of the leg. I don't see any breakdown or swelling or rashes. Again, I'm going to check strength. Go ahead and push down. Perfect. And up. Perfect. Next, I would want to check the feet. I would be looking at the toenails, making sure that they're not real thick or there's no fungus there. If she was a diabetic, I would want to check in between the toes, making sure there's no breakdown in between the toes, no hidden sores. Also want to check capillary refill. Check it again by the nail bed. If they have polish on like she does, you can just check the tip of the toe, making sure that it comes back within 2 seconds, which it does. The warm, making sure they're warm to the touch, they're not cold, which they're both good. Again, we already assessed the heels, making sure there's no wounds. We want to make sure we're checking the dorsalis pedis pulses. Again, we would do these both at the same time, making sure that they're even on the same feet. And then we would want to do the post-tibial pulses. Again, making sure that they are both even bilaterally. And then also the popliteals, making sure that they're even bilaterally. Okay, the last thing we would want to do is check for sensory. We want to check for if she has the sensation. So if you could go ahead and close your eyes for me, perfect. And let me know if you feel it anywhere.
What foot? Right knee. Right big toe. Left pinky toe.
Perfect. And then the next thing we would want to do is check her back and make sure that everything is okay on the back side. So because she's able to move, we're going to have her roll over. Keep her as covered as possible. And here I would put on gloves. Again, just checking the heels, making sure there's no wounds. I would be checking the sacrum and the coccyx, making sure there's no wounds. Checking the back for any breakdown, rashes. Here I'd be checking the buttocks, and I would let my patient know I'm going to be checking your buttocks. You're going to feel my hand, gently lifting the buttocks. We would want to check the anus, make sure there's no bleeding, redness, swelling, see if there's any hemorrhoids, dryness, any of that going on down there. Note that. You can go ahead and turn back over for me. I would remove my gloves, wash my hands. I did forget to check her feet strength. So if you could push towards that way. Perfect. And towards you. Good. Again, I would wash my hands. I would reposition my patient, put the call light within reach. And that's it. Thank you.